Let's take a look at this easy situational judgment test question relating to dealing with pressure and stress. So, Tom is a final year student on a busy medical rotation. He has an important exam in 2 days, but is also scheduled for a whole day of placement. He's feeling overwhelmed by the competing demands. How appropriate are his responses? So, A, speaking to his supervisor about adjusting his shift schedule temporarily. This would be a very appropriate thing to do. This is the way that Tom should address this situation. It maintains his responsibilities, but it proactively addresses his workload as well. B, powering through without rest, studying during quiet moments during placement. It is appropriate. He is actively taking on his workload. It is well intentioned, but it is risking personal well being, burnout perhaps, and potentially patient safety as well, depending on how preoccupied he is. C, calling in sick to avoid the placement entirely. This puts unnecessary strain on the other team as part of the placement, and it is also dishonest and unprofessional, so very inappropriate. And then D, asking a peer to unofficially cover his placement tasks so he can study for the exam. This again would be an inappropriate response, but not awful, as the workload is still being covered, but it is violating these professional protocols. So, inappropriate course of action. Let's take a look at this medium level difficulty dealing with pressure and stress question from the situational judgment test. So the scenario is that a registrar realizes they prescribed the wrong dose but corrected it before harm occurred. The error wasn't documented. And we need to choose the most appropriate and the least appropriate response, with the third option being a null option. I think it's best to read through all three options first, and then quite often finding the least appropriate is the easiest. A, document the error openly and discuss it in the team debrief without shaming the registrar. B, mention it only to a trusted colleague for advice. Or C, say nothing to avoid scrutiny. So I think the easiest one to identify is the least appropriate, and that is C. The reason it's the least appropriate is because it is unethical, it is unsafe, the mistake goes uncorrected as well, it goes unchallenged. You are acting as a bystander and nothing changes. It's unprofessional. Now, our most appropriate response is going to be A, document the error openly and discuss it in the team debrief without shaming the registrar, without making it personal. This is promoting transparency and learning for the group together, the whole team. So this would be the most appropriate. And then mentioning it only to a trusted colleague for advice, although this does kind of address the issue, it doesn't address the issue in an open, transparent way that then improves the whole team together. So this would be our null option. Let's take a look at this hard situational judgment test question relating to dealing with pressure and stress. The scenario is that a junior doctor notices a senior colleague making repeated medication errors due to exhaustion. The team is understaffed and the senior seems defensive when questioned. We have really, really strong hierarchies within the medical profession, and this level of seniority can quite often lead to conflict and can lead to challenges when it comes to addressing mistakes. Let's talk about these different responses and how appropriate each of these responses may be. So A, discreetly reporting concerns to the clinical supervisor with specific examples. This would be a very appropriate response. It is directly challenging what has happened. It is addressing these issues, and it is prioritizing patient safety professionally. B, correcting the errors silently without confronting the senior. Now, appropriate because we are addressing the mistakes and prioritizing that patient safety, but it does not address the underlying issues. And it also increases the chances of burnout and exhaustion. So appropriate, but not ideal. C, suggesting a team meeting about workload pressures. Again, this would be appropriate. It addresses the issue, but it's perhaps untimely, and it perhaps is an indirect workaround as to the core issue at hand of the errors in the medications. So appropriate, but not ideal. And then last one, D, ignoring the errors to avoid conflict. As a general theme throughout the situational judgment test, if anything is saying to ignore it, that's the least appropriate thing to do. This is failing in our professional duty. We all have a duty to withhold and uphold the highest professional standards, and this is being complicit and allowing them to go unchallenged. So this would be very inappropriate.